Hello all, I am Dr. Sriharsha, Associate Consultant, Orthopaedic Oncosurgeon working at Apollo Cancer Institute, Jubilee. We have Dr. Rajeev Reddy, the specialist doctor. Sir, can you please introduce yourself?
Good afternoon, everybody. I am Dr. Rajeev Reddy, consultant in orthopedic oncology and sarcomas at Apollo Hospital, Jubilee Hills in Hyderabad. We welcome you all to this Facebook session on International Childhood Cancer Awareness Day.
We are here to discuss about bone tumors and bone cancers in children on the eve of International Childhood Cancer Day this February 14th. So, Dr. Rajeev, what is the first and foremost thing? What are sarcomas?
Yes, on this February 15th, that is International Childhood Cancer Awareness Day, there is an increased effort to spread the knowledge about bone cancers and bone tumors. Sarcomas are cancers or tumors that arise from bones, joints, muscles, skin, or the fat, generally in the limbs, in the back, as well as in the pelvis. That is, it could be the upper limbs, the hands, or it could be the lower limbs, that is, the legs, the knee joints, and the thighs. It is a rare form of cancer that generally occurs in younger population, that is in children below the age of 20 years. So sarcomas are basically nothing but bone cancers or bone tumors that arise in a younger population generally.
Okay, how common are sarcomas in children?
Unfortunately, these bone cancers or sarcomas are commonly seen in children, as we had just discussed, usually under the age of 20 years, even though bone tumors are seen in an elderly age group or in the middle age group also, but the aggressive form of sarcomas like osteosarcomas or Ewing sarcomas are generally seen in children less than 20 years of age. That is, Ewing sarcoma is seen between 5 to 10 years of age, and in osteosarcoma, the adolescent age group is commonly affected. Also, tumors like bone cysts, that is simple bone cyst or aneurysmal bone cyst, are also common in the younger age group, that is in these children who are less than 20 years of age. Hence, overall we can say that sarcomas or bone tumors are relatively common in the younger children in the younger age group, and they follow a specific age related pattern.
Dr. Rajiv, as we hear the word tumors, are all tumors sarcomas?
It is wrong to assume that all tumors are sarcomas. Tumors is a general broad term, and tumors can be of three main types. That is, they can be benign tumors. The word benign meaning that this particular tumor, that is swelling, the bad swelling, starts in the bone, but it remains inside the bone for a very long period of time, and the chances of this swelling or tumor spreading to other organs is very less. The second type of bone tumors are malignant tumors, or commonly called as bone cancers, or in medical terminology they are called as sarcomas. These are the aggressive cancers wherein the tumor begins in the bone, but it can spread to other organs like the lungs or other bones through the blood. And these are the ones that need to be identified quickly and treated quickly. They can be life threatening if they are not treated properly. The third type of cancers, which are seen generally in the elderly population, are called as metastatic tumors. That is, tumors or cancers which arise in another part like the thyroid or breast or lung or prostate cancer, which then spread through the blood from the thyroid or the lung to the bones through the bloodstream, that is through the blood. Since there are 206 bones in the body, these cancers from other organs can spread to the blood, through the blood to any of these bones. Hence, tumors in general is a very broad term, and it involves benign tumors, malignant cancers, as well as metastatic cancers. In all these tumors, like if we look at the general population, we usually see bone cancers or sarcomas in children and metastatic cancers in an elderly population.
Okay. How do you identify? How do we identify the bone tumors in children, especially in children?
It's a major concern to identify these tumors or these sarcomas or cancers in children as soon as possible, because the sooner we identify these problems, the easier it is to treat and make sure that the child returns to his normal physical activity and normal life as soon as possible. If we ignore the signs or if we delay the signs, then these cancers or tumors can spread and can unfortunately cause life-threatening problems. Especially for parents, there are a few signs that indicate that the child may be having some sinister or some other non-regular problem inside the bones or inside the hands and legs. These include pain. The child usually will point to the site of the pain and say that he's having pain over there when he's walking, or sometimes even in the night when the child is sleeping, he might get up and say that there is pain. This is a very important indicator that there is something wrong going on in the limbs. In younger children who are not able to express themselves, the child may cry if somebody holds the child's leg or hand and holds the child in a particular position. If the child is able to walk and if the problem is in the legs, then parents usually notice that the child is not walking normally and he may be limping, or there may be a slight difference in the walking style as compared to what they usually see. Also, mothers especially notice that there is a swelling in the limbs or in the back which is increasing in size, and that itself is an important sign that something wrong is happening. If the child is having persistent pain, increasing swellings, or sometimes occasionally fever which is not subsiding, then it is time to take the child for a checkup to either a pediatrician or an orthopedic surgeon or an orthopedic oncologist. Though these symptoms are not specific to any bone tumors or any bone cancers, generally we see these are the signs and symptoms which could turn out to be bone cancers or sarcomas later on.
Okay, after we identify the bone tumors, what are the treatment options for sarcomas in children?
Once the orthopedic surgeon or pediatrician refers the patient to an orthopedic oncologist, or the patient himself comes to an orthopedic oncologist, the first thing that any child or parents are asked to get is an X-ray. After detailed history and talking to the parents and examining the child, an X-ray is the first test that is done. And once we identify that there is something wrong going on inside the bone on the X-rays, then we move to another investigation called as an MRI scan. An X-ray is a basic investigation which gives us a lot of information, and an MRI is a better investigation because it gives us very accurate characteristics of this particular problem inside the bone, around the muscles, around the joint, and in other areas. Once the MRI is done, then the orthopedic oncologist usually gets an idea whether this is a bone tumor or not. It could be an infection sometimes, it could be tuberculosis also sometimes. Hence, we cannot identify and say it with a lot of confidence after X-ray and MRI that this is definitely a bone tumor or this is definitely a malignant cancer or sarcoma. Then the orthopedic oncologist advises a test called as a biopsy. A biopsy is a simple test wherein most of the times a needle is used to take 3 or 4 pieces of small tissue from the swelling, that is a tumor, inside the bone, and it is sent to the pathologist to look under the microscope and identify what this problem is. The pathologist then looks at it under the microscope and tells us whether this is a tumor or a cancer, and if so, then what kind of tumor or sarcoma it is, because there are many kinds of bone tumors or bone cancers or sarcomas. If it is an infection or a tuberculosis, the biopsy or the other tests, microbiology tests, will identify this as an infection or a tuberculosis also, because many bone tumors or cancers or sarcomas can be confused with tuberculosis or infection as well. Once the biopsy report is available, the orthopedic oncologist then sits down and discusses with the parents about the various treatment options. These usually include chemotherapy, that is a strong medicine which is given to the child in the form of an IV drip, where the child receives these chemotherapy medicines to kill the bone tumor or the sarcoma over a period of multiple chemotherapy cycles. Many times surgery is done after a few cycles of chemotherapy, following which chemotherapy is given again. All these chemotherapy and surgery procedures are done as per international guidelines, which are uniform throughout the world, and they should be done under supervision by a qualified medical oncologist and an orthopedic oncologist. Complications can arise during the treatment of sarcomas in chemotherapy and surgery, but they should be clearly discussed with the parents, and both the parents as well as the treating medical oncologist and orthopedic oncologist are usually on high alert and look for any complications that can develop so that they can be identified early and they can be treated early. With a very cautious approach and high alert approach, usually the chemotherapy and surgery go smoothly and the child has a good outcome if the child presents early with no sarcoma or cancer anywhere else in the body and by taking proper chemotherapy with a good chemotherapy response.
Okay, Dr. Rajiv, according to you, early identification, proper treatment in the form of chemotherapy and surgery are important for the sarcoma patient. So, what functions can we expect after the surgery? Can the patient have a good functional limb after the surgery?
Absolutely. I think the earlier the child is diagnosed with these problems, the easier it is to treat with a very good functional outcome. Ultimately, it is important to identify these problems early, because when you present to the orthopedic oncologist early, then the outcomes are usually very good. Not only do these children have a limb, that is amputation or removing the limb is not necessary in the majority of cases. About 90 to 95% of sarcoma patients don't need an amputation or removing the limb if they present early. Not only can we save the limb doing something called as a limb salvage surgery by an orthopedic oncologist, but also the child can have a good functioning limb with which he can walk, run and do all activities. All this can happen if the child presents early to an orthopedic oncologist and if the treatment that is done the first time is well planned, well executed and done with a lot of planning and precision and care. The end outcomes are good if the chemotherapy response is good and the child has early disease that is present only in the limbs and not anywhere else like the lungs. So yes, most of these children do not need an amputation or removing the limb. The limb can be saved with good outcomes, with good function, so that the child can have a good quality of life and can walk, run and do all activities by himself or herself.
Okay, according to you, the treatment is a teamwork. So, what teams you have and how do they work in coordination?
We should remember that the treatment of bone tumors or sarcomas or bone cancers is, after all, a team effort. That is, an orthopedic oncologist or orthopedic oncosurgeon is a bone tumor or sarcoma specialist who is the one who usually takes the lead and who's the main surgeon who operates, removes these tumors and saves the limb. But closely working with him are other specialists like a radiologist who initially discusses with the orthopedic oncologist about the X-ray and MRI findings, following which a pathologist, an expert pathologist, especially in bone tumors, works closely with the orthopedic oncologist to establish a diagnosis of sarcoma or sometimes other bone tumors or infections or tuberculosis, after which the orthopedic oncologist then works with a medical oncologist or a pediatric medical oncologist who gives chemotherapy and who administers this chemotherapy in an effective dose that is given properly in a controlled environment so that the complications do not arise, and regular monitoring and regular checkup with the medical oncologist makes sure that the chemotherapy is taken correctly. It is important to remember that it's not just giving chemotherapy, but the chemotherapy should be given correctly in the right dose without any compromise, and the medical oncologist should build a relation with the patient in such a way that if the patient or the child has any problem, then they are free to connect with the medical oncologist or the orthopedic oncologist at any time during the day, either physically or by phone or by messaging. This prevents complications from occurring and early identification of complications so that they can be solved quickly. Once the chemotherapy is given by the medical oncologist, usually the orthopedic oncologist then goes ahead and does limb salvage surgery to save the limb so that the child has not only a limb but also a functioning limb so that he can do well. After the surgery, usually some more chemotherapy is given by the medical oncologist, following which the child then gets back to his regular life and follows up once in 3 months with the medical oncologist and the orthopedic oncologist. There are some tumors where radiation is also used as a form of treatment, especially in adult patients in the spine and pelvis, where a radiation oncologist is then involved and specific plans are made to give radiation to the bone or the affected part using modern, well-designed radiation machines which are available with us with the help of expert radiation oncologists.
Dr. Rajeev, what are the facilities available at Apollo Cancer Institute, Jubilee Hills?
Apollo Cancer Institute, Jubilee Hills at Hyderabad is a tertiary level institute with facilities that are world class, and we have a host of specialists in various branches, that is radiation oncologists who give radiation to specific organs and who are specialists, medical oncologists who deal with a wide range of oncology related issues including hematology and bone marrow transplant, and surgeons who are specialized and who deal with specific parts like head and neck or urology or gynec oncology or GI oncology or orthopedic oncology, so that each specific organ receives special attention by a specialist who is dedicated to treating these particular cancers or tumors. Not only that, we have a holistic approach wherein all the experts along with the radiologist and the pathologist sit down every week in a tumor board meeting which is held on every Tuesday, so that an expert multidisciplinary opinion can be sought from the various experts in the best interests of the patient. Apart from having world-class radiation machines and chemotherapy suites and chemotherapy rooms which offer excellent chemotherapy infrastructure in the cleanest of environments, the operation theaters that are required for these kind of major surgeries like bone tumors, bone cancers or limb salvage surgeries in sarcomas are very well equipped and have all the instruments and implants that are required for these major surgeries. Many times we need help from an expert anesthesia team who are very well trained in dealing with these children, pediatric population and very elderly population. So an expert anesthesia team as well as a critical care team to handle these major cases in the post-op is also essential, apart from the nursing staff which has to be trained to make sure that the patient is comfortable in the post-op period as well. So it is not just an orthopedic oncologist or a bone tumor or bone cancer specialist, it is the entire infrastructure and the personnel who are present in a tertiary level institute who are responsible for taking care of the patient in a holistic manner and make sure that the patient is comfortable during the entire course of treatment. This makes sure that the patient is comfortable and the treatment is successful. Right from the time the patient enters Apollo Cancer Institute, Jubilee Hills, the patient is handheld and guided through one of the most difficult times in their life with compassion and empathy, so that it is not just cure, but it's also an experience that the patient has with a lot of people who understand that this is a difficult situation for them.
Thank you, doctor, for sharing your time on bringing the awareness on International Child Cancer Day. For further details and appointments, to get in touch with the doctor, the link is in description. Thank you all.
Thank you all.